Our first surgery is a 47-year-old male patient. There is a previous fracture of the femoral neck. Therefore, he has had 2 surgeries. Due to lack of fusion in the femoral neck, severe pain, leg shortening, and recovery difficulty, surgery was planned to address these issues in the patient's condition. We plan to create a robotic hip prosthesis. Our objective was to plan, program, and execute the surgery with minimal error and utmost precision. We have completed your surgery. We extended the leg length. We equalized the leg length with just 1 millimeter difference. The case has been successfully concluded.